Healthcare topics you need and wellness tips you deserve, all straight from the doctors themselves. Maayong Adlaw, Cebu. I'm Kriya Padilla-Roleda from CDN Digital together with the hospital at Maayo, and this is Maayong Adlaw Doc. In the last episode of Maayong Adlaw Doc Season 4, we had an interesting discussion together with our guest dietitian and nutritionist, Ms. Aubrey Palubon, on the importance of watching what we eat and living or maintaining a balanced lifestyle. Now we're back for another interesting topic, this time about oral health. But before we go over to that and introduce our next guest or our today's guest, let's watch this video first about the hospital at Maayo Dental Care Unit. The hospital at Maayo's Dental Care Unit is a modern dental facility offering affordable yet quality dental care. The hospital at Maayo's Dental Care Facility is equipped with advanced imaging systems to provide clear images that aid in accurate diagnosis. Their dental care staff and consultants aim to offer quality dental care that is hassle-free and pleasant. Here in one of Cebu's bustling cities, Mandaue, the hospital at Maayo is designed to give you the care and services that you deserve. They prioritize your health, put your needs on top, and make sure to give you a holistic medical experience. Now, for today's episode, we will be talking about common mouth problems and gum health. So let's learn more about our oral health from our guest doctor today. A graduate of Cebu Doctors University College of Dentistry, she is also an infection control advocate trained in Singapore. She received her Certificate of Achievement in Central Sterile Supplies Department course in Singapore in 2017. She also completed her comprehensive implant dentistry at the University of Washington, Seattle, and attended several trainings, obtained certifications in preventive and restorative dentistry, laser dentistry, practical periodontology in the Philippines and Singapore, respectively. She completed a one-year clinical and academic program at Center for Orthodontic Research and Studies and is a clear aligner Invisalign-trained dentist in the Philippines. She played a key role in initiating the infection control dental setting of Maayo Dental Care Cebu. Her advocacy has led her to conduct trainings and awareness talks in the community and dental clinics, challenging poor infection control practices with proper guidelines, communication, and professionalism at all times. Let us welcome our guest dentist for today, Dr. Kitty Mumartan. Good afternoon, Dr. Tan. How are you doing?
Good afternoon. I'm good. I'm good. How about you?
That's great. Oh, I'm good. I'm good. And it's great to see somebody who's very, very pretty today. No, it's so refreshing.
Thank you.
You're welcome,
gorgeous
Doc.
also.
Thank you. Ala, nagchikahan na yun lang. Best friends with me right after this. Bitaw, Doc, today is a very interesting episode because we're going to talk about oral health, right? And with that, the topics that we will discuss would be about bad breath, or you mentioned earlier, we call it halitosis, gum diseases, and tooth decay. So let's start with bad breath first. Other people actually, they think that bad breath is something funny, but truth is it's not. No?
Of course it's not.
It's never funny. Having bad breath is not funny, first of all. Especially nowadays that you wear mask, no? Mag-suffer ka because you smell your own breath. And then, and before bitaw, like, it's not funny because you also affect other people and your confidence is also affected.
It's
so
true.
I want to know what are the different causes of bad breath actually?
Well, when we talk about bad breath, there are actually a lot of factors that contributes to it. So it's caused by dental or non-dental. So at first, I will talk to you about the dental. Okay, for the dental side, if you have caries on your teeth, you have a tooth decay, of course it can cause bad breath. If you have gum abscess, and then if you have stomatitis, if you have periodontitis, gingivitis.
Okay, so I don't understand them anymore.
Those are like the inflammations of the gums that can cause halitosis, or what we call bad breath. And for the non-dental, of course, we have the food intake. When you eat like garlic or smelly foods like onions, and if you have a habit also of smoking and vaping, it can contribute.
which means that we should avoid those types of food, kanang mga very spicy and smelly food.
Well, I don't see it as really avoid the smelly food because I love those spicy
I love
food.
spices.
Yes, but we should very well know how to take good care of our teeth after we eat.
So
how
after
to take
eating
care
them,
of,
no brush
yes,
lang dayon.
how to take good
Right.
care of our mouth so that we can eat those food also. And also another causes of bad breath is also those underlying medical conditions. So if you have like liver problems, like if you have renal problems or nasopharyngeal infections, it can contribute to the smell.
How does that affect your breath? Those problems, those other health problems.
Sometimes when we do have our sinusitis, like some leakage on the sinus, it can also contribute to a very foul smelling of the
Okay,
bad
so
breath.
since
Yes.
they're inside of
They're
us,
inside, and gastrointestinal, like
they come out from
gastritis,
our breath.
ulcers, yes, it can actually
I see.
it can actually contribute to the smell. But the first thing is, of course, the dental should be ruled out first. So when you observe that when you have a bad breath, then you should go to the dentist first, and then we will assess if it's really by dental origin. And if it's not by dental origin, then that's the time that we refer you to a medical practitioner or assess the bad breath or refer you to a specialist. So to find out where the odor is coming from.
The problem is, what if you don't know that you actually have a bad breath?
That is actually why we should visit our dentist also regularly. And of course, it's not bad to ask also your family members if you have morning breath.
Right,
Yes,
no?
if you have a bad breath.
Oh, speaking of morning breath, is that normal? Or is there such a thing as, you wake up with fresh
I don't
breath?
think so. It's normal because it's been like you've been sleeping and then for the entire night and
What happens inside? How come it becomes smelly when you wake up, when you actually brushed prior to sleeping?
because there is actually less saliva when you sleep, and it causes dry mouth also when you sleep. So that is why when you wake up in the morning, it is not. It causes like a little bit of dehydration in your oral cavity. So that triggers also the smell of it. Yeah. So in the morning, you just have to do your proper hygiene before you kiss someone.
Okay.
Okay.
I want to go back to the food. You mentioned earlier, now we don't really have to avoid those spicy foods, no smelly ones.
I don't believe in avoiding such
Oo,
diet.
as long as we really take good care lang, we brush right after we eat so that the smell doesn't stay in our mouth.
Yes.
Okay, but are there some foods now we really need to avoid for our teeth?
Well, sugary food, of course, and acidic food, because of course sugar is not good for our teeth. So we should have a diet that is with less sugar, because sugar can also cause tooth decay. And when you have a tooth decay, then of course it will rotten. You'll have a rotten smell of your breath, and it is caused by dental factors.
Is it sugar alone, or are there other types of food?
Sugar
that we
and
should
acidic
avoid?
food? Yeah.
Okay. How about food that is actually good for our teeth?
Well, what's good for your teeth is also good for your body.
Ah,
So
okay.
yes.
So fruits,
Vegetables,
vegetables, balanced
yes.
diet, right?
Balanced
Doc?
diet,
Ah.
exactly.
Since we're in bad breath pa, I want to know ba na if you have one, you mentioned earlier, we have to identify first whether it's dental or medical?
If it's non-dental,
Non-dental.
Yes.
If it's dental, what are the solutions to that?
well, we treat what is causing the bad breath. If it's a cavity, of course, we do tooth filling. If it's an abscess, we treat the abscess of the gums or the abscess of the tooth. So it's basically just treating and making sure that your mouth, your oral health is in good condition and everything is fine, that there will be no cause of any bad odor or halitosis.
How do we prevent bad breath? Of course, the answer would, almost everybody would know na you brush your teeth, you rinse your mouth with,
Yes.
what are those brands of mouthwashes?
Okay.
But is it healthy to keep on using mouthwash like morning, noon, and night?
Actually, nowadays, there are mouthwash that is alcohol-free. So for that one, it is for your discretion if you really want to use that.
Which one is better for you, Doc? Which
Of
one
course,
would
the
you
one with
recommend?
non-alcohol.
Really?
Yeah, because
But the one with alcohol feels good.
yes, I guess it dehydrates your mouth,
it
so
does.
it's not also good. Okay, using mouthwash also daily can greatly affects like the staining of your teeth. So I would say that it's also not good.
So it's not good to use morning, noon, and night?
No, it's not good, but it depends also on the type of mouthwash. Nowadays, we have a lot of mouthwash that says that it can be done, but for me, I don't think I don't want to use it like 3 times a day. Maybe in the morning after I brush your teeth, or maybe when I need to, but not really every day. Because the one that I am using also is I don't want you to use it every day, so it depends.
You're talking about mouthwashes that have colors. You mentioned staining of teeth. So are you
Oh.
talking about the mouthwashes with colors?
No. The colors of the mouthwash doesn't affect. It's basically because when you use a mouthwash, it actually removes a little bit of the stains when you eat a lot of colorful food. It easily attaches into the teeth when you use the mouthwash.
I see.
Yes.
Okay. So basta, your recommendation is that we don't need to use mouthwash 3 times a day.
I do believe in that. Yeah.
Oo. Just as needed lang yun siguro. Right?
As
If you
needed.
feel like you've eaten something really smelly, no, that's the time we use mouthwash.
Yes,
Oo.
yes.
Okay, so too much, too clean is also not too very good for our mouth. You mentioned, Doc, acidic food, sugary. I also read somewhere that starchy food are actually not good for the teeth because the starch can stick and turn into sugar in between our teeth and can also cause rotting of the teeth.
Yes. Yes. Actually, if you already have a plaque or a buildup of calculus, then it's really not good on your teeth. So that is the indication that you should already go to the dentist and have your regular oral prophylaxis to have it removed, because the plaques and the calculus can actually cause your gums to be inflamed. And yes, it can rot in your teeth and can cause dental cavities. So you should be very careful when you see even just a white spot. So you should go and check with the dentist if this is a cavity or not. Or it should be something that you should be worried about.
Okay. Are we supposed to be scared with kaning cavities? Or okay ra na sila? We can feel that right away? Or scared in a sense na you might lose your teeth because they might pull it out right away. The dentist might decide to pull it and you lose all your teeth eventually.
Well, when you say scared, you mean you are scared that you have a cavity, or you are scared of the dentist? That's a different thing. Okay.
No. The cavities ba? How are we supposed to make sure that we don't have cavities? And then,
Okay.
yeah, how are the dentists supposed to treat these cavities? I know that there are cavities that are small, they're big.
Yes.
So
there are actually stages of the cavities. So the first thing is when you see a white spot or white lesion in it. When you do your regular
it's white,
checkup,
Doc, not black or something.
it can progress into black. But those very early incipient caries that we call, the dentist with your regular checkup, we can spot it immediately. Okay, and with that, we can assess if we can do a filling or we will just do fluoridation for your teeth. But if you have that, and if you suspect, like if you've already seen that there's already a very big cavity and it's colored black already, then please have it filled with the dentist. I mean, the dentist will actually treat it and assess how deep is the cavity, because that is actually the start, and we don't want you to end up with a very, very big pulpitis or very, very big swollen face, and the pain is actually excruciating.
Right.
So, yeah, so you should be afraid of the pain.
If we start with very small cavities, are we supposed to fill that? Or are you supposed to fill that or just treat it with something else?
If it's very small cavities, we have a treatment for that. It depends on the type of cavities. If there's
Do we fill it right away or not
we
really?
we can feel it because it can progress. Yes, we can also do a lot of interceptive treatment also, but yes.
How
feel
do
it.
we know, Doc, if your teeth that has cavity or cavities, how do we know if it's supposed to be pulled out already, or how do we know if it's worth saving pa?
Okay. Actually, dentists save teeth. Okay. But there are cases wherein we really cannot save the tooth because restoring it, or the restoration for it, the prognosis is poor, so not good. So that's the time wherein we actually decide that we need to extract the tooth, and this tooth can't be saved anymore. And we have to explain to the patient that this is what happened, like this is your tooth, and if we are going to save it, if you want us to save it, then this may not last you for like a year, so you will just be wasting money, or the cost is too high to save this tooth.
You might as well pull it out.
Yes, like the prognosis of this tooth is really bad, or we really cannot save the tooth, period. It's like that. But when we explain that to the patient, of course, we have our diagnostic tools. We have the x-rays, okay, to explain it to the patient. So only then the patient can understand, and then we will have the option, we can give the patient the option of what do you really want to do with your tooth. So if you're decided to just leave it, we don't extract, this is what will happen to you. Okay? And if you're going to extract, this is also the after treatment when we extract the tooth. And if you're going to fill, this is what you're going to face in the next 2 weeks or in the next year. So it's up to you. The decision is with the patient, but of course, we have to present the proper and the very transparent treatment plan for every patient.
Great. Doc, is there such thing as perfect set of teeth na from baby pa siya until ni grow old na siya, wala good ng cavities? Have you ever seen something like that? Or have you read in your studies something like that? Curiously.
By birth? Like perfect set of teeth?
Not by birth. Like, little pa siya, and then mag-start na. Of course, the milk teeth will always fall off, right? But ever since the start of the permanent teeth, halos wala gid nag-caries. Is there such a case like that?
Well, I think there are those what we call gifted, okay?
Gifted,
but
good.
I haven't seen a perfect set of teeth that was not treated with orthodontic treatment.
So it's normal for people to have cavities.
It's normal.
I'm asking. Kay, you mentioned that you haven't seen naman yun, nga wala gi cavities.
No, I was talking about the occlusion, because when we say about perfect teeth, it's like
cavities.
A perfect no cavities. If we do have interceptive treatment for those kids, like we can do fluoridation, then it can actually prevent them to have cavities, which is actually very effective. Yes. Maybe in a more advanced countries, they do have a lot, but here I haven't seen yet like those perfect one with no cavities, except those who had their sealants. Like when they had their first molar, they have this tooth sealed, they have the sealants, then they have fluoridation, then yes, they grew up to have no cavities, and they're very good with their dental hygiene.
I'm just wondering, but what's the worst case na cavity have you ever encountered?
The worst case
and
of
then
cavity?
how did it affect one's health, gid bitaw?
The worst that I've encountered for a cavity is actually just swollen.
So asa ang swell, Doc?
Yes,
ang
because
cheeks.
usually the patients will see us if they already have a swollen face. Yes,
God,
and
a bit too late na.
A bit too late because the tooth is already irreversible, and I cannot restore it with the filling, so I must extract it. But the thing is, it is with a very big swollen, and then there's a lot of pus, so I cannot extract it immediately.
Yeah, so you have to wait.
So I have to pre-medicate the patient.
Yes.
I have to give an antibiotics, a painkiller, and then ask the patient to come back. Or else, if I'm going to extract it, the patient's going to be in so much pain, which I also don't want in my dental chair. Yeah, so that's the worst thing. If you come to see a dentist and it's too late, then yeah, it's a worst thing for the patient.
How about gum diseases, Doc? Is cavity a cause of gum disease, or it's just one of the causes, or not at all even?
The causes of gum disease? Well, cavity is on the tooth, right? The gum
The
disease is
skins
on
is
the
right.
yes, on the gums, on the surrounding structures of the teeth. The causes of gum disease, plaque, calculus, and also some bacteria in a periodontal disease.
Is there such thing also as you mentioned na bad breath could be dental nga cause or the other is non-dental? Napod like that in gum disease na non-dental and dental cause?
Yes, because there are actually medications like if the patient have an existing medical condition, they have some medications that can actually affect the gums. So there are those medications. It actually affects also. But mostly the cause of it is the calculus and the plaque. So that's why you have a gum disease. So it's gingivitis. If it's already, when you brush your teeth, if you see that it's already bleeding, like there's a bleeding, it's already an indication. It's already an indication that you need to see your dentist because it means that you have to clean your teeth already because it's already inflamed, like the gums. Next is periodontitis. This one is a more serious type because periodontitis actually affects the attachments of your teeth, like periodontal ligament. It can cause mobility. Like it can be mobile.
The teeth.
Yeah, so you just wake up one morning and you feel like, how come my tooth is already moving? Like
and
my
then you
teeth
will
is
wait
already
na lang for the tooth fairy.
Yes, and the tooth fairy will give you something. Okay, so that's the more serious one because we need to assess it by, of course, we will take the X-ray, panoramic X-ray for it, and then we assess the bone loss, if the tooth can still be saved or not, by deep scaling or periodontal treatment. So I hope
Those are
that
two already. You have gingivitis,
periodontitis, yes.
and are there others
gum abscess, like
caused by?
caused by periapical abscess, like the tooth, caused by the tooth, decayed tooth. That actually the infection actually goes out into the gum. So if you see like those cases where you have the gum boil, so those are infections that coming up from the infected tooth. Okay, so that one also is really very bad.
How do we treat that though?
Usually, if it goes like that, we can do it with extraction or you can do root canal. But I am not very sure of the prognosis if it already goes into a gum boil. Maybe a little bit of what we call like epicoectomy or episectomy, like a little bit of surgery. Yes.
As if kasabot ko no.
Yes, it's just like removing the tip of the root to clean it up and to remove the granuloma and everything. And of course, antibiotics. But I hope that it will not come to that. Yeah, so those are like gum diseases also. We also have, what else? Not very common, but we've seen cases of oral cancers also.
Oh, that's
Yes,
interesting.
so-
I haven't heard of that. What's
You
that,
know,
Doc?
you have a sore, like mouth sores, and if it's not healing, so usually when the patient will come to us and will complain of a mouth sore, so we usually have a medication for it, or we assess like why you're having a mouth sore. It could be due to your denture, it could be
Doc?
due to certain things. Like
Doc, when we say mouth sore, what's the equivalent in Visayan term for that?
it's luas.
Luas. Okay.
Luas.
So luas.
Luas that is not healing.
I see.
So we
Sige,
always
continue,
see
Doc,
that.
please. I'm sorry, I had to cut.
Yeah, it's okay. When you see a luas that is not healing, then it could be an indication of more serious problem.
No, I had to check my mouth.
Yes, you have to check your mouth. So you have to go and check and have it assessed properly. Because we've seen cases like that it is,
Oral
we thought that
cancer,
it's just a normal, but then it doesn't heal. No matter what we do, like we've already removed all the things that can affect the luas or affect the mouth sores, like the denture. We make sure that it's not hitting on that area, but still it's not healing. So we referred it into a specialist, and then we found that it's a cancer.
So, like, for cases like that, Doc, those are referred to oncologists already? Or
Usually we
dentist
refer it to our oral maxillofacial surgeons.
facial surgeons?
Oral maxillofacial surgeons for our dentist that specializes in those, specializes in oral cancers or specializes in
But are these
surgeries.
cancers like the cancers that people have, like breast cancer, liver cancer? No?
No, it's
Ah.
just
Okay.
no, it's a dentist. But the dentist, the oral maxillofacial surgeon, will
Ano the
work with the
cancer?
oncologist.
I'm talking about the cancer itself. It's like a real cancer, yun.
Yeah,
Also, they
yeah.
have to go to an oncologist also.
Yes, but
Oh.
the oral
For the
surgeon will be
treatment.
the one to
Yes.
will be the one to work hand in hand with the oncologist for that. And
So they're the one doing the surgery.
Yes, they're the
while
one.
the oncologist is the one managing all the
Yes,
cancers.
yes.
There you go. Okay. Kasi nabot. All right, sige Doc. Thank you. That's very interesting. This is actually the first time I heard about oral cancer. No? So you
so
should
it
watch
can
out
easily be
also,
detected.
guys.
With just general dentists can actually detect it with when the patient will tell us that it's not healing. So that is already a sign that maybe we should investigate more. So we refer.
How long should an ordinary mouth sore DI should, how long should it how long does it take time for it to heal? There you go.
Oh, actually,
The normal lang.
I am not very sure of how long, but if you have a mouth sore, usually like 21 days, it's already healing. Or
How long,
or no, like those not mouth sore, but if
The
you
luas,
if-
Doc, ba?
But the luas should heal very fast because our mouth heals very very fast.
Okay.
You know, if you have some mouth sores, like let's say if you have some wound in your mouth, in your oral cavity, it can actually close up like in 24, 48 hours because it is very fast in healing. But for those, there are those like in like 21 days. I have seen those, and it's not healing yet, but it can heal also. Yeah, but for those like always there and it's not healing no matter
Like
what we
months
do.
na, Doc.
Yes, and the patient is already really complaining that it's already affecting the way she eats.
Bothersome na
It
gyud.
bothers
Oo.
na. So that's the time that we should do more investigation. You know, just to be very sure. There's nothing
okay.
wrong with just being sure. I mean, we are not perfect, so
Bitaw, oo. I'm asking because I'm not the kind of person who usually gets luas, so I don't have an idea actually how long kanang mga luas would last in the mouth. So supposedly dali ra. Yeah, but
supposedly if you put a medication of it, it can heal very very fast. Yeah.
okay. Without medication, what's the worst thing that can happen to your sore?
Without medication, actually some sores just go and heal.
no?
Yes.
Is it caused by bacteria, Doc, or by virus?
Oh, some they can cause.
Both can cause.
Yes,
I
there are
see.
some, but I don't want to talk about
Okay.
it. Yeah,
All
there
right.
are those.
But both can
Yes.
can cause.
yes,
Oo,
so
mouth
you,
sore. All right.
there are some infectious sores also.
Sige, Doc. Thank you. Now let's talk about sensitive teeth.
Oh, okay.
What makes one sensitive? Like, what makes a set of teeth sensitive? What
Well,
causes sensitive teeth?
sensitivity of teeth is actually very, very.
Or is
hard to
one
treat.
born with sensitive teeth?
No.
No.
For me, it's quite challenging to treat based on my experience. But mostly, the causes of sensitive teeth. Sometimes we do have these non-carious cavity lesions that can also cause sensitivity. Okay, non-carious meaning if you see the cervical portion of your teeth, like there's a little bit of a ledge, so they say it's probably because of too much brushing using hard bristles.
yes, yes.
Yes. But there are also causes that it is really because of the anatomy of the tooth.
Okay.
But yes, but that one I don't want to explain it further. But
Yeah.
as when you have that, like when you have that lesion on your teeth, it's very sensitive. So that one is also a cause of tooth sensitivity. And the treatment for that is we just fill it up. These are non-carious cavity lesions. So we just fill it up with a composite filling, and then our GIC, and then everything will be okay. So it won't be sensitive anymore. But there are those teeth that is really sensitive, and we really don't know why. Okay, that is why we have this sensitive toothpaste.
I see.
Okay,
Oo.
but not all. I am not here to recommend any brand
Yes,
because
of
I do
course.
believe that if you try every other brand. So if you are okay with this brand, then maybe it works for you. And then if not, then you try to another brand also.
Yeah, there's a myriad of brands of
Yes, so it
toothpaste
is.
for sensitive teeth.
Yeah,
right?
so it is
Oo.
very. Maybe we have those who specializes on sensitive teeth, but yes.
But
that's
if
what-
you were to recommend, Doc, what should a very good toothpaste contain? for us to be guided lang ba? Like, because again, there's so many toothpastes out there. So which one should we really choose?
Well, the one
Based on their contents or composition.
Well, I use the one with the fluoride. I mean, the one that is available in the market is really our toothpaste that we can use. It is actually the matter of how you brush your teeth.
I see.
Yeah.
Okay, so all our toothpastes mostly are
Yes,
good.
it's acceptable.
Yeah.
Yes, it's good also.
Okay, so it's
So it's
how you're supposed to brush your teeth.
How you brush your teeth. If you brush it properly, then it's okay. It's acceptable. Even if you use mechanical toothbrushing or the electric one, yeah, it's also the same.
Yeah. Are they really effective?
They're both effective.
Which one is better? Kanang mag-manual ta or mag-mechanical?
No one is better. It's the same.
Ah, really?
Yes, it's just like a matter of which one are you comfortable with. If you are tired, if you have some wrist issues, then use the electronic. But study shows they're the same.
I see. And I thought those electronic ones are for lazy ones. Not
Can be
necessarily.
also. I have both. I have mechanical. I have for lazy ones. No.
Okay, so toothpaste, no problem. Almost all brands available are good for us, right? They have fluoride,
Yes.
calcium, and stuff. Toothbrushes, though, okay, it's really up to
They
the
have
person.
I recommend a soft bristles.
Yeah, I wonder, why is there hard bristle, soft bristle, and medium bristle? But most dentists would recommend the soft one. So why do we make these hard ones when in fact they're not doctor recommended? I don't understand.
I also asked the same question. But we don't know, maybe the manufacturers, maybe they think also that those toothbrushes with the hard bristles can be used also on another things. No, just kidding.
What, hard mouth?
Hard mouth. Yeah. But, dental, they say our oral cavity evolves with age. So I would still recommend the soft bristles for a lot of reasons. Yeah. Like it's very soft and soft to your gums, and also it will not create any lesions into your teeth.
I was just wondering, Doc, na if it's soft bristles, can we be assured that it can actually get those dirt or food particles in between our teeth or around our teeth? Kay soft man siya. As compared to hard, nga probably it can really like
The type of toothbrush bristles.
oo.
No. It will not guarantee you that
Okay.
it can actually clean the interproximal spaces on the teeth. We do have a lot of types of toothbrush. So we have interproximal toothbrushes that can go in between your teeth. And of course, we also have a floss, like
What's
dental floss.
interproximal
If you
toothbrush,
see,
Doc?
if you go to Watson's or in the grocery or in the supermarket, you can see those little toothbrushes with a very tiny bristles that they have sizes like 0.1 mm, 0.5
Oh, yes.
mm.
Yes. I've seen
Yes.
that. Those
so
ones.
that one can clean your
In between
interproximal
your-
in between your teeth. If you don't have that, you can always use flossing.
So
Yes,
flossing is
very
really good
effective.
for us.
It is very effective.
But I wonder why Filipinos are not so fond of flossing. Maybe because it's expensive.
Oh, is it? It's not.
Kidding.
Yeah, but
Or maybe it's
think
because it's
they're-
hassle.
Maybe, but now we really recommend flossing because it's the only. I mean, unless you go to the dentist every day, but it's the only one that can go in between
Yes, actually that's
your
true.
interproximal spaces.
Speaking
Yeah.
of flossing, Doc, Filipinos have this habit of actually using toothpick. What can you say about the use of toothpick in between our teeth?
The toothpick, actually, the size of a toothpick is actually quite big to go into the interproximal spaces. So it will create spaces. Okay.
So continuous
So it's not
use
good.
would actually make gaps in between teeth?
Yes, because
Is
you're
that
going to use it like very hard and push it. I know because my mom uses it and I really hate it when she does. So it is not good.
Okay. See,
Maybe
toothpick's not good.
Maybe it's good if you just remove on the edges but not really go in because it will
In
hurt.
between, you know?
It will hurt your gums and it will actually bleed sometimes, right? When you poke the toothpick in it. Yeah. But the interproximal brushes, they're also very thin, but thinner than Toothpick. So I think that is one is
And they're
much
safe
better.
to go in between our
Yes,
teeth.
and they're safe. But then they also have sizes. So you just make sure that you don't hurt. Like if you see the spaces in between your teeth, you have to make sure that it doesn't hurt. If it hurts and if it bleeds, then it's probably traumatizing your gums. So don't
We
do
should
that.
stop
We should
doing
stop
it. Okay.
Yeah.
Toothpick, not good for the teeth.
Not good if you stop it.
Oh, yes. Okay. Doc, how often should we see a dentist in a year? We are told twice a year, but is it still true, or should we see it more often? Should we see the dentists more often?
Why would you see a dentist in a year for have your oral prophylaxis? Oh. Well, it is really recommended to see a dentist every 6 months, okay, for cleaning. All right, but if you have certain issues on your teeth, go and see a dentist immediately.
Yes.
Okay, it might be too late. Okay, you might lose your teeth.
That's right.
Okay, so if it's the first time, like for me, if it's the first time that I am seeing you, and you're for oral prophylaxis or for tooth cleaning, I would recommend you, okay, come back in 6 months' time. When you come back after 6 months, and then I can see that you have a lot of accumulations, you have a lot of plaques, calculus. Of course, I will not blame you that you didn't brush your teeth.
Katsabaan pa ba?
You know, because there are actually people who's actually very prone to calculus.
Yes. So
Maybe
don't
the type
judge.
Don't judge. Maybe the type of saliva or the
Yes,
way
yes.
their diet, or maybe they really don't brush their teeth. So if that happens, then I will really tell the patient, you see me in every 4 months, okay?
Okay.
Or every 4 to 6 months.
It depends
Yes, it
on the
depends.
patient's
Yes, but
dental,
recommended is twice a
situation.
year.
All right,
Yes.
thank you, Doc. One last question from me. What's the importance of dental health to our overall health? No?
Well,
What's the effect of your dental health to your overall health?
you know, it's been said that oral health is a window to our general health. Okay? So it really greatly affects our well-being. When I say it's well-being, it's it's the quality of your life. So it's how you feel about yourself and about your life. So if your dental health is very poor, or you have a lot of dental issues, infections, then it will greatly affect the quality of your life. So it will have a very big impact on you. Not only that, it is, like there are a lot of studies that actually relates dental health or dental infections to certain medical conditions, like it may lead to premature birth, to lungs and heart disease, to stroke, to diabetes. And not only that, if you also have a visibly very bad dental health, it also affects the way on how you interact with
Correct.
with people.
I agree.
And it affects your confidence.
Yes.
It affects your self-esteem. And it's not good. It will totally affect not only physical health, but psychological, emotional, and financial.
I agree.
So it is very important to really take good care of your dental health and visit your dentist regularly.
So far, we've learned so much from Dr. Ketty. This time, Doc, I want to ask, what are the different services given by the hospital at Maayo when it comes to dental care?
Well, Maayo Dental Care offers all dental services. Of course, the general services that includes the extraction, fillings. We also do veneers. We also do dentures and implants and surgical cases. We do have. In Maayo Dental Care, we have a group of specialists or consultants that will actually help us with all our procedures. So basically, it's everything you can find in Maayo Dental Care.
That's wonderful. So if you have dental care needs, visit the hospital at Maayo.
Yes.
Thank you very much. We
Thank
learned so
you.
much from you today, and we hope to see you again in the show. Thank you, Doc.
Thank you so much.
And that's it for our second episode of Maayong Adlaw Docs Season 4. All right. Thank you very much for watching this episode today. Please share this video to your friends and family so they may also learn from our discussions today. And of course, from their promise of Maayo, which in Cebuano means be well, experience a new healthcare experience, or discover a new healthcare experience here in Cebu at the hospital at Maayo. Now, if you want to learn more about the hospital at Maayo, please check out their Facebook page or visit their website at thehospital@maayo.com, or check out these numbers below. I'm Priya Padilla from CDN Digital. See you again next time.